Yes, greetings to you. Hopefully, you're doing very, very well. My name is Robert Semwez, one of the directors at HBMS TV. Remember, HBMS TV is a television station that is purposely there to help educate you on how you can live a healthier life. Remember, it is powered by Masaka Home-Based Medical Services International. That is an organization that is in Masaka. And what it entirely does is to give you a health work that you may need at home. We do outreaches, we do a lot of things at Masaka Home-Based Medical Services. Then HBMS TV is here to make sure that it brings you fun, it brings you what things that are interesting and very, very many things out there. But today I'm chanced to be hosting one of our wonderful tutors at Mityana Institute of Nursing and Midwifery in a program called Pulse Points at Minimum. So sister, you're welcome.
Thank you very much.
We kindly request that you introduce yourself to our viewers at HBMS TV so that they get to know who you are and what you do.
Okay, thank you very much for the invite. I'm glad to be here. My name is Nyadoi Vanessa, a clinical instructor in Mityana Institute of Nursing.
Clinical instructor, Mityana Institute of Nursing and Midwifery. So I want to let you know that the program you're in is called Pulse Points at Minimum.
Okay.
Pulse Points at Minimum is a program for fun. There is always a lot of fun and learning, but also there is a question why people choose Mityana Institute of Nursing and Midwifery. So before we get into the details of the session for today, we would want to know you as a clinical instructor, you as a staff at Mityana Institute of Nursing and Midwifery. What is that one thing that makes you pulsate, that every time you think about it, it makes your heart to skip a beat, you pulsate and what have you? What is that one thing?
Okay, first of all, I'm very glad to be a medical worker, most so in Mityana Institute of Nursing.
Yeah.
First of all, here in Mityana Institute of Nursing,
Yeah.
what really gives me that urge to be here in this place is the fact that our environment is very, very favorable for everyone, not only the students, but the tutors, all the staff, starting from the cleaners. They are very welcoming. Yes, so the other thing is the way we offer our services here in Mityana Institute of Nursing. We not only teach students, but we groom them into ladies and gentlemen of tomorrow. Yes, we don't only keep them in class and stop on the learning basis, but we show them different things about life. And that one thing for sure gives me a lot of urge to stay here and be a staff of Mityana Institute of Nursing.
Wow, I like that. Now, the other question that I would want to get from you as a clinical instructor, I understand when a student comes here in a semester basis, every semester there is a time they are in class for around 3 months. Then they have a month where they go for placement. Could you let our viewer out there know to which places you take the students and what experience do they get out there?
Okay, thank you very much. Well, first of all, as he has said, there are periods where our students are in class, and also there are periods when our students go out there to get the experience they came for, hands-on practice. And as he has asked me about the different places where we take our students. First of all, here in Mityana, we have our own general hospital called Mityana
General Hospital, one of the best. Actually, I've been there and it is a nice place.
Yes, it offers very good services and they take each and every client very important. Yes.
Do they have a private wing at Mityana General Hospital?
Yes, they do, and at a very affordable amount.
So
feel free, even if you come pregnant and by any chance things get off guard, please don't worry. Just go directly to Mityana General Hospitals. There are specialists there that will take very good care of you. Yes.
Okay. Which other places do you take your students? Because I understand you have a very big population and really appreciate the director for the wonderful job that he's doing, that a lot of students from different parts of the country come, even beyond Uganda. You have students from Rwanda, I understand you have students from Kenya, Tanzania. So the question is, what other hospitals, where do you take the students for placement?
Yes, first of all, as he has said, we have really a variety of groups of students that come here in Mityana Institute of Nursing, and we thank you very much for choosing this school.
Yeah.
People come from very far places, Rwanda, Burundi, everywhere, coming just to get skills from here.
Yeah.
Then the other thing I would like to say, please parents, don't be afraid that your child would be a distance away from you to be in this school. Everything is provided security wise, mentally wise, physically wise. Your child would definitely be fine.
Yeah.
So back to the point, he was
where you take the students for clinical placement.
Yes.
Yeah.
So we also take our students to Mubende General Hospital.
Mubende, one of the best. I understand Mubende is a regional referral, right?
Yes.
Yeah, so people go there also for experience.
Yes.
That is good. Which other places?
We also take our students to Nakaseke.
Yeah.
Yes. And we also take our students to Hoima.
Yeah.
Yes.
It's also a regional referral.
Yes.
For which tribe is commonly known from Hoima? Are they the Batoro, Banyoro? Which tribe is common there?
I think the Batoro,
Banyoro. And then the Banyoro.
Yes.
Yeah.
Yes.
So do you also take students to Chiboga? I understand there are students who go to Chiboga.
Yes.
Oh, that is good. So those are the places. Now, what is that knowledge that these students speak from there that they do not get in class? We want you to paint a picture of what really is gotten from the placements.
Yes, first of all, when these students get out there, they meet different professionals. Yeah. Whereby these people are able to guide them step by step practically. Yeah. For example, when we are in class, a tutor can tell you that a pregnant mother is supposed to be handled in this way and this way. Theoretically. Yeah. So when you go to these different placement sites, our professionals take time to teach our students. If a mother has come, how are you supposed to handle her? How are you supposed to welcome her? How are you supposed to allay the anxiety and they feel comfortable and they are open to do whatever you ask them to do so that you can be able to help them. I get. Then the other thing, it also concerns about the use of instruments. Yeah. As you all know, in hospitals, we have very many instruments. Yeah. Whereby, if you don't see them physically, touch them and know how to use them, you will never know how to use them even during the examination period, during practicals. I get. Yes, for example, how to administer medicine. For example, intramuscular. Yeah. Yes, so our professionals show them how to handle the syringe, show them how to administer, what procedures you have to go through in order to make sure you give quality services to our patients. Oh, that is good. So thank you very much. In the same manner, we want to say thank you to the staff of the different hospitals that you take the students to, because they simply come out and train the students and then they get what they expected out of the course. So we will be getting into a short break. Remember, we've had clinical instructor from Mityana Institute of Nursing and Midwifery, that is Madame Vanessa, on our pulse points at minimum, and we are coming back to you. We go for a short break. Thank you.
Katonda wange lengere somere litendeka abasawo n'abazaalisa Mityana Institute of Nursing and Midwifery namatidde dda owange alina kusomera wano lyazimbibwa walungi lirina buli kimu si kweyiiya nga n'omwana alisomeddemu tayinza kubulwa mulimu afuluma mukugu mu kyakola lisangibwa Mityana mu tawuni kulidde ebuswa bulongo Mityana Institute of Nursing and Midwifery weewandiise kati ebisale byabwe tebitiisa naawe laba waaka lengera omutindo.
Yes, welcome back from that short break. Remember, Home-Based Medical Services Television was purposely started to help educate you on how you can live a healthier life. We are fully certified by the UCC, and we are here to serve you. So do not hesitate to subscribe, share, like, and what have you, and so that we can keep in touch. You can also follow us on all our social media platforms, including Twitter, which is it is now X, the former Twitter. You can get us on TikTok, you can get us on Facebook, you can get us on all social media platforms, including YouTube. And remember this program, the Pulse Points at Minim, we're always live every Friday at 8 p.m. So we want to let you know that today we have our guest in our studio, and that is a clinical instructor from Mityana, Institute of Nursing and Midwifery. This program is always about learning, about fun, about why people choose Mityana Institute of Nursing and Midwifery. So now back to our guest, Madam Vanessa. What is that one thing that makes you happy while you're at Mityana Institute of Nursing and Midwifery?
First of all, thank you very much for this opportunity to be here in front of you. Once again, my name is Nyadoi Vanessa, a clinical instructor at Mityana Institute of Nursing. Well, to answer what he has said, first of all, Mityana Institute of Nursing is not only a school, but a home where our students come to learn and have skills in order to take care of our patients at different locations and hospitals. Yes.
So what is that one thing that makes you happy in the work experience, leave alone being a staff, leave alone, but what is that thing outside class, outside hospital placement? What is that one thing that makes you happy, that every time you think about it, it makes you happy?
Okay, one thing for sure, I can say, one thing that really makes me happy are that different people in different categories of professions I meet every single day.
You're here, you meet a non-teaching staff, you meet a cook, you meet a security guard, you meet a PRO, you meet different people. That gives you joy and it makes you happy.
It gives me a lot of joy because I'm not only enclosed in my own profession, but I get to interact with other people, get to see the challenges and know the challenges they always go through. And it helps me to also know how to go about some things in case I get there. So that really makes me always happy and glad to be in this place.
Thank you. So the other thing that a viewer would want to understand, yes, you're in a work environment. If anyone asked you what stresses you while you're at work, could you be open to telling our viewers at HBMS TV what is that one thing that at times it stresses you?
Well, to actually answer that, truth be told, me as a clinical instructor, the only thing that stresses me is when my students are not going forward and not doing the right thing at the right time in the right place.
It does not leave you the same.
It doesn't. Because me as a clinical instructor, whenever I get complaints from the principal nursing officer, from the in-charges on ward, that my students in Mityana Institute of Nursing are not doing the correct things, sincerely, I feel so perturbed.
So back to the students, make sure that you always go for your placement as the clinical instructor instructs. And as we come to the end of our session for today, your visit, we would want you to send greetings to your loved ones and also a word to your students as we are winding up. Thank you.
Thank you very much. Well, one thing for sure, I would like to first thank the director of this school, Mr. Chintu John. Is the director of this school, Mityana Institute of Nursing and Midwifery. I thank him very much for giving me this opportunity to be in such an environment where it adds up to me a lot of things.
You can't go through this institution and remain the same. You can't work from me and remain the same.
Exactly.
I like that.
Yes. Second of all, I would like to send greetings to all the staffs of Mityana Institute of Nursing.
If you don't mind, you could mention a few names here and there, because however much, because I understand the population is too big, you could at least mention out a few people and say, I send greetings to so and so, so and so. You can even send greetings to the host, the person hosting you here.
Well, first of all, thank you so much for hosting me.
By the way, when I'm here, I'm not a staff at Mityana Institute of Nursing and Midwifery.
Yes.
I become now the staff at HBMS TV.
Okay.
Yeah, that is that category that you look at when I'm here with you on camera. But to tell you, I'm also a staff of Mityana Institute of Nursing and Midwifery. And I say thank you for sending greetings to me.
You're most welcome.
Yeah.
Well, I would also like to send greetings to our dear principal,
Madame Nachewa Florence,
yes.
The mother to everyone.
Exactly.
I like that.
Yes, that lady grooms everyone in this compound.
Yeah.
He not only grooms students, but also grooms us, the staff, especially the young generation like me.
I understand.
Yes.
Yeah.
She's a mother to us.
Yeah.
And she adds up a lot onto us.
That is good.
Yes. Second of all, I would like to also send my greetings. By the way, if you must know, we have a diploma here at Mityana Institute of Nursing.
We wouldn't leave that out. Diploma extension.
Yes, we have
nursing and midwifery.
Yes.
I like that.
We have diploma here. We also have pharmacy.
Yeah.
Yes, and we also have the lab side.
Don't forget about our mother institution, that is Mityana Grovet Institute.
Yes, exactly.
Yeah.
Yes, so in case you have your child is so interested in being for animals.
Yeah.
Yes, he's interested in being a pharmacist.
Yeah.
He's interested in upgrading his or her education level from certificate to diploma.
They are all welcome.
They are very, very welcome here at Mityana Institute of Nursing. Our prices are very low.
I like that.
Yes, and we provide accommodation. So kindly feel free. You might say, oh, this place is very far.
Yeah.
My dear, when you travel all the way from Kampala to here, trust me, you have where to sleep and your property will definitely be safe.
Thank you.
Yes.
So I want to welcome you once again from that sharing from our clinical instructor. Remember that TV is HBMS TV, a channel that was purposely started to help educate you. Remember, the program is Pulse Points at Minimum, so do not miss watching us live every Friday at 8 p.m. May God bless you. Have a great evening.
Ensangi zino okutegeera ensonga z'ebyobulamu kizibu nnyo nga tutaddeemu ssente. Awo nno Home Based Medical Services Television weeviriddeyo era Director Semwezi Robert Masaka kaakukakasa kyentegeeza.
TV eno yatandikibwa n'omulamwa okulaba nga tutumbula ebyobulamu era tuyina programs ez'enjawulo ze tukola okulaba nga tusobola okunnyonnyola engeri gy'osobola okutambuzaamu obulamu bwo nga bulungi.
Okulanga naffe tukubire ku noti 779 noti 55 75 HBMS TV Talking Health.
Yagwe eyeetawulatawula mu kibuga onoonya ki? Noonya weesobola okujja omwenge omulungi naye nkuze ntya? Toddamu kweraliikirira abagula ejja shoppers abasangibwa ku Banda Stage Mityana batunda wines ne spirits mu bika byonna nga Double Black, Gold Wine, Red Label, Four Cousins, JP Kennedy, Berera, Captain Morgan, Amalula, Bond 7, Uganda Waragi, Gilbis ne Bia mu bika byonna batunda mukamukamu n'okusuubuza. Okumanya ebisingawo bakubireko ku 075 25 14 9 ne ku 075 13 11 21 be bagula ejja shoppers abasangibwa Mityana ku Banda Stage.